All right, welcome back, everybody. Dry eye disease is very common, especially for those of us who are middle-aged or older. In fact, it is estimated that almost 5 million of us have it, and it is most common in women. Dr. Stephanie Engebretson is an associate optometrist with North Shore Eye Health and Wellness, and she is here now with more on what causes it and how to say goodbye to this annoying problem. I had the treatment, and you can too. Great to see you.
Good to see you too.
So dry eye, I was just looking it up because I knew you were going to be here. I have it. I was surprised to read everywhere that it says dry eye disease.
Dry eye is a disease. A lot of our education is spent telling patients that this is a chronic progressive condition, and if we don't treat it appropriately or efficiently and do appropriate management, things are going to get worse.
What are some of the symptoms of it? Because I have shared often with people, you think dry eye, you're going to have no liquid in your eye, but it actually it used to cause me to tear up a lot, sure. But it irritates your eye. It feels like really bad allergies.
Yeah. A lot of, or most commonly redness, scratchiness, itching. Tearing is a sign of dryness too. Redness, that sort of thing.
And if you get something in your eye when you have dry eye disease, it's super frustrating because it seems like it sticks there, like it's cutting your eyeball.
Yeah, for sure.
Okay, let's talk a little bit about this treatment for it because it's super common. I went in to have an exam and went through a lot of different tests. What's something that you might look at that would tell you that someone has dry eye disease? So we're looking at this diagram here.
Yeah, so we screen, the majority of our adult patients with a machine called a liposcan. And it takes a photo like this, and we go over these with the patient. And on that top picture, there's a really normal scenario.
If we can go back to that picture before we get to my treatment, because this is important because it shows that inner lid, right?
Yep.
Okay, we'll get back to it in a second. So that top picture was a healthy,
very normal, healthy individual. Yep.
Okay, there we go.
Below there, ones that are missing have died off, more of a severe gland disease state, that sort of thing. Yeah.
Okay, so one of the things that you and Dr. Ross told me when I was at the office was that you have this treatment in office, and I'm going to talk about the results and how it went for me. But what's the idea of this treatment? It's called LipiFlow.
LipiFlow is a thermal pulsation treatment. So essentially what happens is, you have these applicators on the eye, and what we're looking to do is warm up those glands and secrete all this bad oil that might be in there. So goal is to get more of a healthy oil production and reduce those symptoms.
Okay, so we did a little videotape when I was there. What I feel, it's almost like having little suction cups on your eyeballs. It sounds like it would be painful, but they put a little numbing drop in there. I thought it was extremely tolerable. It was a little weird at first because you can't see.
They're a little daunting, that's for sure.
Yeah, just the application part. But once they start the procedure, it actually feels really good because it feels like almost like your eyes are getting a warm wash.
Yep. The heat is actually 10 degrees above normal body temperature. And then as you experience, massage, pulsations, that sort of thing. And then at the end, it's a gentle pressure, like you are correct. So kind of like a massage, just to get rid of that bad oil in there.
Yeah, are there risks with it or things people should be aware of? Because one of the things I remember you guys saying is there's the numbing drops, was that you can really screen with those tests that you do to see if you'd be a good candidate for this.
Not a whole lot of risks for the procedure. We're big advocates, to go through with it. So benefits are pretty much outweigh those risks for sure, and longevity of the disease and that sort of thing.
Yeah, talk about the benefits, because I had this, I want to say about a month ago, I have a follow-up visit coming where you'll look to see if the glands have, if they're improved.
Yeah, so we do a follow-up with our patients about 4 weeks out just to see how things are going. Afterwards, we'd say, hey, you might feel a little bit more dry, that sort of thing, because we've emptied all that oil out. But around 4 weeks, you start feeling some relief of that redness and the burning and the tearing.
Yeah, and you guys do such great you send patients like me home with such great home care. So it's like the omega-3 drops, which are very lubricating. I got these little eye goggles that everybody gets. You can heat them in the microwave and put them on. It's very soothing. And then you take an omega-3 supplement that helps your body naturally produce more oil for your eyes.
Yeah, so all of those home therapies are essential in maintaining your results for LipiFlow. And on top of that too, continue your follow-up with us so we can see see those results and keep continuing your treatment plan from there. Yeah.
Real quickly, because we ran out of time, how long do the results last? So if you get these oil glands working again, they've been stimulated, and it's a really quick procedure, like 15 minutes in office, how long do those results last?
So results can vary, but a lot of people are done with one treatment as long as you're maintaining those maintenance therapies that we sign for you at home.
I think it's a huge benefit. Thank you
really
so much
Thank
for
you.
explaining it, especially because dry eye disease is so common. I bet you or someone you know has it. If you want to do a consultation and take some tests just to see if you're a good candidate, if you experience chronic dry eye symptoms, you're wondering if LipiFlow might be right for you, you can contact the experts at North Shore Eye Health and Wellness. Their number is on the screen, 262-421-4412, or for more information, you can visit northshore-eye.com.